Eric Hammer here, registered physiotherapist. Today, I'd like to talk to you about the importance of recognizing compensations within muscle groups. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, especially when I'm seeing a patient where there might be some chronic pain or when there's pain that's come on insidiously, right? So that where there hasn't been a specific trauma, a specific injury that a patient can point to. So for example, a sprained ankle or an incident in which they hyperextended their knee. So where there's not a specific incident and they're coming in with discomfort, with pain of some type. Really what I want to do is recognize if there's any discrepancies in terms of certain muscles that might be being overused or other muscles that are weak, and where these compensations might be taking place. Because in a lot of instances with these type of patients, right, we're looking for kind of the biomechanical factors that might be contributing to their discomfort and pain. So for example, the glute medius muscle, which is a muscle that runs along the side of the hip, and it's responsible for hip abduction, so basically bringing the leg out to the side. It's responsible for keeping our pelvis parallel when we're weight bearing. If that muscle is weak, for example, right, and we're doing different weight bearing specific exercises, in some cases, right, there can be an overuse of muscles like your psoas, so your hip flexor, or your quadricep muscle, or your TFL, which is a muscle that attaches onto your IT band. So in these cases, what's happened is because of this weakness in the glute medius muscle, well, other muscles have to now work overtime to compensate for that weakness, and now it can create a movement impairment. It can create dysfunction in terms of how somebody might be moving, and then this overuse, and then pain and discomfort as a result of this. So again, that's a really sort of typical example of what I'll see in terms of compensations, but really important, right, to recognize that when there isn't a specific incident that occurred, that more than likely somewhere along the chain, right, and that's I always speak about the body as a chain, right, that one area can impact and influence another. We want to identify along this chain, hey, where's this compensation taking place that's creating this movement dysfunction where now the patient is in pain. If you have any specific questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this information is appropriate for you. Thanks again for watching, and have a great day. Take care.